Hello, thank you for joining us. We'll get started in just a few minutes. Hello, thank you for joining us. Please use the chat feature to tell us where you're joining from. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The nurse planner and content experts in control of the content today have no relevant financial relationships to disclose with ineligible companies. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following this presentation, if we have time, we'll have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to our presenter. Be sure to hit send so the message makes it to us. Please use the Q&A feature to ask questions and the chat feature to interact with other participants. We'd like to thank our speaker for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our speaker today is Dr. Siobhán O'Connor. Dr. O'Connor is a senior lecturer at the University of Manchester, UK, and an adjunct associate professor at Western University, Canada. She has a multidisciplinary background in nursing and information systems, completing her PhD in health informatics, and has nearly 20 years combined experience in industry, clinical practice, and higher education. Her research focuses on the design, implementation, and use of technology in healthcare. And she also undertakes the pedagogical research exploring digital, online, and virtual forms of learning. Dr. O'Connor has received several grants for nursing informatics research from funders such as Innovate UK, the Burdett Trust of Nursing, and Sigma Nursing. She won a RCN Foundation Impact Award in 2018 for her work on the history of nursing informatics in the UK, and in 2022 received an Emerging Nurse Researcher Scholar Award from Sigma Nursing as an active member of Phi Mu chapter. Welcome, we're so grateful to have you, and we'll turn it over to you.
Hi, Linda. That's great. Thanks for the introduction. You're very kind. And hello, everyone. Thank you so much for coming along to the Sigma Nursing webinar. As Linda said, my name is Siobhán, and I'm delighted to speak to you today about artificial intelligence in nursing. Great. Well, actually, I'm based at King's College London. I've moved here recently in the last couple of weeks from Manchester, and I'm based in the Florence Nightingale Faculty for Nursing, Midwifery and Palliative Care. And as Linda mentioned, I'm a long-standing member of Sigma Nursing in the Phi Mu chapter here in England. I'm a nurse by trade, but I came into nursing a little bit later in life. So my first degree at university was in a subject called information systems, which you won't find at every university, but it's basically a mix of computer science and business or organizational management. And then I worked for several years in financial services in Dublin, Ireland as a data analyst before retraining as a nurse in my late 20s. So because I have a technical and clinical background, all of my teaching and research is on technology and healthcare. And now I have an interest in artificial intelligence because it's a hot topic in informatics, and I think something that nurses need to get involved in. So for today's session, it's just a very brief introduction to artificial intelligence because AI is a huge field. So I'll start by talking about where artificial intelligence has come from. Then I'll discuss some of the main domains and techniques in the field, and that'll bring us nicely on to how artificial intelligence is being used in nursing and how nurses can contribute to this new technological trend. I also would like to give a nod to Florence Nightingale. She's most famous for her work on infection control during the Crimean War, but she had a background in statistics before she became a nurse, and that mathematical background was really instrumental in a lot of the pioneering work that she did throughout her life, including her work on infection control. So she's often referred to as the world's first nursing informatician. And no doubt if Florence were here today, she would be the leading light in relation to AI in nursing. So just starting with some simple background on artificial intelligence, it's a very big field that develops and applies advanced computational techniques to digital data. And AI has many different areas within it that look at different aspects of human intelligence and try and mimic it using software and hardware. So AI could look at anything from abstract reasoning to learning, decision-making, communicating, or interacting with the virtual or physical world around us if you're into robotics, chatbots, or gaming. There's also lots of definitions of artificial intelligence describing sort of what it is and what it isn't. And even in the field of computer science, there's no real agreement about what AI is because people tend to interpret it in different ways. But I quite like this description from an EU report that summarized and synthesized many definitions of AI because it's quite sort of detailed without being too technical. It takes into account hardware and software and the different application areas of AI. And it also talks about how AI can use symbolic rules or predictive predictive modeling, because there's lots of different forms of artificial intelligence. It's not just one particular technique in one application area. So I think that definition is quite useful to work from, and no doubt it'll change over time as AI develops and changes into the future. So artificial intelligence began way back in the 1950s after the end of the Second World War, when breakthroughs by Alan Turing and others in computing and encryption encouraged people to explore AI. Marvin Minsky and John McCarthy are on the slide. Both of them worked at MIT in the United States, and they're considered to be the founders of the field because they organized a series of meetings and then conferences in the mid-1950s and beyond that started research into AI. But it didn't really take off until much more recently, because there was lots of experimentation and dead ends in the 60s, 70s, and 80s. And it wasn't until the early 1990s when advanced computational techniques like machine learning and natural language processing started to emerge. And since then, the field of AI has been expanding rapidly. And interestingly, you'll find AI being applied in nursing as far back as the early 1990s. The example on the slide is from a nurse called Rose Harvey from Boston College in the USA. And it's one of the earliest research studies that we found when searching. But to be honest, I wouldn't be surprised if there were studies going back into the 1980s as well. It's just a little bit more difficult to search for research the further back you go, because the language around AI has changed and various journals and conferences have come and gone. But even way back then, some nurses were really on the ball in terms of informatics, and the rest of us are just catching up 30 years later. It was also around that time that the American Nurses Association recognized informatics as a speciality within nursing, and the ANA developed their first scope and standards of nursing informatics practice in the mid-1990s. So I wonder if this piece of research, and no doubt others, influenced that positive step in nursing. So there are many different areas within AI, such as fuzzy logic, expert systems, Bayesian networks, etc. But just for today, given the time constraints, I'll just talk about the two main areas because they're the most popular and widely used techniques, but you'll come across other things as well. So machine learning is the first domain, and these are all the algorithms that are used to learn from past data to build predictive models. And then the second area that's quite popular is called natural language processing, or NLP. And as the name suggests, it uses software techniques to understand text or voice data. The other thing to be aware of is that AI also overlaps with neighboring fields like data science, text mining, and good old-fashioned statistics, because they share some techniques in common. So it can be a little confusing and sort of messy when you start reading about AI, as you'll probably come across those fields as well. So starting off with the main set of AI techniques are called machine learning. And as I mentioned, these are all the algorithms that are used to learn from past data to build predictive models. The algorithms are grouped into three categories, which are supervised learning, unsupervised learning, and reinforcement learning. And I'll briefly go through each of these and give you some practical examples from healthcare. So the most popular set of machine learning techniques are called supervised learning, and this is kind of in principle how they work. You have an electronic data set to work with, and you need to annotate or label a subset of that, which is called the training data set. And the labels are associated with specific features or characteristics in the data, and they're labeled by a human expert. Then you select one or more supervised learning techniques, which could be things like a decision tree, random forest, support vector machines. They all work slightly differently in terms of how they analyze the data. And then the algorithms build a mathematical model based on the labeled data provided and the known outputs, and learns the rules or trends it finds in the training data set to produce an output. Then you apply the algorithms on the test data set to generate the final predictive model or output. And now it's quite popular as well to have a validation data set and a test data set. So that's why these techniques are called supervised learning, because you sort of tell the algorithms what to do to some degree by labeling the data set and knowing the output that you're going to get at the end. So this is a practical example of how that works in healthcare, because it might seem a bit abstract. So this is a decision tree, which is the simplest supervised machine learning algorithm and one of the most popular. And it's good at handling classification and regression tasks. And hopefully the diagram helps to visually explain how it works. It's a hierarchical tree-like structure which has a root node at the top, branches, internal nodes or decision points, and then leaf nodes at the end. So the algorithm splits the data in a top-down recursive way until all or most of the electronic records have been classified under the specific class labels or the leaf nodes at the end, representing all the possible outcomes. And this is a really nice example from a Canadian research team who developed and validated an AI algorithm to prioritize access to care home services for older adults. So they created their own decision tree algorithm called Maply for that specific purpose. And this is what it looks like. The figure is just straight from the paper. They had a data set of over 4,000 older adults to identify predictors for nursing home placement. Then they created a computerized decision support tool based on this algorithm to help case managers identify people at risk or at high need of care home services so that they could prioritize older people who needed support more quickly and provide that instead of an older person maybe deteriorating at home and ending up in a hospital for weeks or even months when they should have gone to a care home. And the link is on the slide that'll take you to the full paper, which is open access and explains in more detail how they did this piece of research. So that was just a visual representation of how a decision tree algorithm works. In reality, it looks something more like this, which is a lot of programming code, because the two main programming languages that are used in AI are called Python and R. And just to say that any AI technique, whether it's a decision tree or anything else, every algorithm has its advantages and disadvantages. So for a decision tree, the obvious sort of benefit is its simplicity. It's easy to interpret, little or no data preparation is required, and it's very sort of flexible compared to other algorithms. However, some of those things are also a drawback, because if you have a large, complex data set and very complex decision making to do, then it's not much good to you because it's too simplistic. And it's also prone to overfitting when it moves from running on the training dataset to the test dataset. But it is a very popular AI algorithm. Another really popular type of supervised machine learning that I want to touch on, because it has huge applications in nursing and healthcare, is called an artificial neural network, or it's more commonly called deep learning, where data is processed through many layers. So as you can see on the visualization, the algorithm is comprised of layers of nodes containing an input layer, one or more hidden layers, and then an output layer at the end, which is why it's referred to as deep learning. So each node or artificial neuron connects to another and has an associated weight and threshold. And if the output of any individual node is above the specified threshold value, then the node is activated and it sends data to the next layer in the network. Otherwise, no data is passed along. So it's kind of modeled on the human brain and how neurons in the brain work. And because there are so many layers to neural networks, it's not possible to tell which variables in the dataset the algorithm actually uses to arrive at the final predictive model or outcome. So they're often referred to as a black box. And just like any supervised technique, neural networks rely on training data to learn and improve their accuracy over time, helping to classify and cluster large volumes of data at high speed. So they're really, really useful in healthcare, particularly for image recognition software in radiology, and they're also used a lot in speech recognition systems. And also just to note that there are different types or configurations of neural networks that are used for different purposes, depending on the data that you have and the type of complex modeling that you need to do. So there isn't sort of one standardized approach. So you might come across things like perceptrons, multi-layer perceptrons, convolution neural networks, recurrent neural networks, etc., etc. There's quite a few different configurations, but they're a very useful AI algorithm. And this is a really nice example of how a neural network was applied in healthcare to improve the accuracy of diagnosing skin conditions in primary care. So this research team developed a web-based tool and used photographs of skin conditions and the corresponding medical history of patients to build a predictive model based on a neural network. And the aim was to improve outcome prediction for hundreds of skin conditions in primary care where there isn't a lot of expertise in dermatology. So the link again is on the slide to the publication, and it's open access if you'd like to read it in more detail. But basically, they had a data set of over 16,000 cases to train the AI model, and then they asked 20 primary care physicians and 20 nurse practitioners to review a subset of those patient cases, with some using the AI web tool and others using the standard approach, just reviewing patients' medical records to compare the two. And they found that when using the AI tool, clinicians were able to identify skin conditions more accurately, which corresponded to a benefit in about 1 in every 8 to 10 cases, which isn't a massive improvement, but I think it's a good way to apply neural networks in healthcare. Then the next category of machine learning is called unsupervised learning. And these algorithms work differently because they're used to analyze and cluster unlabeled data sets and discover patterns or groupings without the need for human intervention, which is why they're referred to as being unsupervised. And these algorithms are used for different types of tasks, which include clustering, association, and dimensionality reduction. And that's kind of about reducing noise or variance in a data set if it's too big without losing the integrity of the data. And so these ones are more about descriptive modeling and telling you what patterns, groups, or relationships are in your data set rather than trying to predict things, but they are very useful. So again, here's a nice example of an unsupervised machine learning algorithm. K-means clustering is very common, and this is where key variables or characteristics in the data are assigned into a number of groups or clusters based on the distance from each group's centroid. So the example on the slide is from a team of nurses who developed a patient classification system that stratifies patients admitted to intensive care based on their disease severity and nursing workload. So they extracted data on 300 critical care patients from the hospital's electronic medical record system, and then they used a number of AI techniques, including K-means clustering, to assign patients into 3 subgroups using 16 different characteristics, 8 of which were related to disease severity, and then 8 about nursing workloads. And as you can see those on the graph, I've just taken that directly from the paper. And again, the link is on the slide if you'd like to read it in more detail. But as you can see, each of the groups are actually quite different, with Group A having the highest disease severity and needing the most nursing care because the patients are on mechanical ventilation. So this approach could be used to help nurse managers identify similar patient groups who've got specific care needs and then assign nursing staff according to their levels of clinical expertise to improve the management of critically ill patients. But of course, like any AI technique, it needs good quality data to work well. And then finally, the last type of machine learning is called reinforcement learning. And this is quite different because it focuses on optimizing sequential decision making when the decisions are repeated over time and when they occur in a dynamic or changing environment where there's some level of uncertainty, which really sort of mimics the real world. So reinforcement learning works within a mathematical framework consisting of 3 elements, which are the state space, and that's the available information or the problem features that you have to work with. Then the second is the action space, which are the decisions that you need to take at each state of the system. And then the third is the reward signal, which is just the feedback about how the agent or algorithm performed. And that might be positive or negative. And you might also like to include things like system constraints and uncertainty into your models. So it's really sort of akin to learning by experience. And we'll look at a practical example on the next slide. But reinforcement learning is used a lot in robotics, in things like self-driving cars, in chatbots like ChatGPT, etc. So it's got a lot of practical applications. And like before, there's lots of different reinforcement learning techniques like temporal difference, Q-learning, Monte Carlo methods, etc. And they all have their advantages and disadvantages like any AI technique. So this is one example of how reinforcement learning has been applied in healthcare. This research team developed a digital intervention to encourage women to attend mammography screening, and it was based on reinforcement learning techniques. Over 100,000 women were sent regular emails over 2 years to encourage them to attend for a mammogram, and the AI algorithms were used to personalize the email content and use behavioral nudging to encourage attendance. As you can see, an example of that on the slide on the right-hand side, in terms of the emails that the women got, and the link to the published study is there as well if you'd like more information. And then on the left, you can see they would email groups of women for sort of 4 to 5 months at a time, then take a break and start again. And over time, the algorithms optimize the message composition based on the women's past behavioral responses, such as opening messages, clicking calls to action, and then scheduling and attending mammograms. And then it selected various content to put in the emails to maximize the probability that the recipients will complete the target behavior. The research team didn't look at the effectiveness of this and whether it actually worked or not. The study was just a feasibility really approach to see if it was possible to do this, but presumably there's a clinical trial maybe in the pipeline or underway at the moment that would look at its efficacy, and hopefully it does improve attendance at mammography screening. So that's one really interesting application of reinforcement learning in healthcare. Then the other main domain in AI that's very popular is called natural language processing, which uses software techniques, mainly symbolic rules, things like tokenization, part of speech tagging, etc., to understand and respond to text or voice data, particularly if the data is very large and unstructured. So NLP uses a combination of computational linguistics or rule-based modeling of human language with traditional statistics, and it also uses machine learning, in particular deep learning models, to process human language, whether it's audio, written text, or both, to try and understand what it means. And this is a nice application of NLP in healthcare, where a research group in the United States extracted unstructured free text data, such as notes from physicians, nurses, and social workers on over 800 children from an electronic medical record. And they extracted the data before the child was referred to the child protection team to try and identify which ones were at risk of or victims of physical abuse to improve screening and speed up the referral process. Again, the figure is directly from the research paper, which you can access via the link on the slide. So they used 3 different NLP techniques called bag of words, word embeddings, and rules-based to train multiple neural networks to detect cases of likely child abuse. And as you can see, they trained 8 or 9 different models to see which one would be most accurate and reduce the false positive rate. And now that they've done this, they want to take the best performing model and develop a computerized platform to speed up and improve the accuracy of screening and referring children to child protection services. So that's a really nice application of NLP in healthcare. So now that we've covered sort of the main domains within artificial intelligence, what is actually happening with AI in nursing? So some colleagues and I did a systematic review to help answer that question last year, and I'll go through what we found with you. Our review actually was cited in the International Council of Nurses position statement on digital health transformation and nursing practice. So it was nice to see our research influencing some high-level policy. Great. So we had 3 research questions underpinning the review, which were how involved nurses were in AI research, what areas of nursing was artificial intelligence being employed in, covering clinical practice, education, research, and policy, and then what were the benefits, limitations, and risks of AI. So we used the standard approach and developed a search strategy covering the key terms and ran those on a number of databases using a 20-year timeframe. We excluded studies where AI was under development, simulated, prototyped, or not applied to any real-world dataset or scenario, or where any specific AI techniques were not described in some detail. And we also excluded the usual sort of conference proceedings, theses, discussion articles, and grey literature. We did find a couple of other reviews on AI in nursing and extracted studies from those as well to include in ours. So we ran our search in July 2021, so it is a little bit out of date now, but we found just over 2,000 studies, and after screening ended up including 140. We didn't undertake any critical appraisal, mainly because the studies were quite technical in nature, coming from engineering and computer science, and the usual checklist just wouldn't apply. And also because the review was non-funded. So we were trying to get it done over the summer of 2021 in between teaching semesters, so our resources and time were a little bit limited. So instead, we just ranked the studies according to the journal's impact factor as a rough kind of proxy for quality, which I appreciate isn't a perfect metric to use. And then after extracting data, we summarize the studies in a descriptive way, because again, most of them are quite technical. So any type of meta-analysis or even some type of narrative synthesis wouldn't really have worked. So it's quite a descriptive review, but hopefully it's a useful starting point to understand how AI is being employed in nursing. So in terms of the results and study characteristics, the majority of studies were conducted in the Americas, with 65 from the United States, 10 from Canada, and 2 from Brazil. Quite a few studies, 39 in total, were from the Asia Pacific region, with research groups in China, Taiwan, Japan, South Korea, Australia, and Hong Kong. There were a small number of studies from Europe, 21 in total from a whole range of countries, including the UK. And then there were 3 studies in the Middle East from Iran and Saudi Arabia. There was one multi-center study that included data from 9 countries, one of which was Ghana in West Africa. But other than that, there were no studies, unfortunately, from the continent of Africa. As you can see, there's been a huge increase in the number of studies over the last few years across all regions of the world. Some of the algorithms do go back into the 1990s, but there are many more algorithms now, and they're much easier to apply than they were previously. And alongside that, computing power and storage capacity has increased massively during that time period as well, making AI research much more doable. And there's more funding available, hence the rapid increase in the number of studies over the last few years. And my guess is that that trend will continue. So the study designs were primarily quantitative in nature, using retrospective cross-sectional or cohort designs, but a few studies did use mixed methods or qualitative approaches. Data sets from electronic health records in hospitals were most commonly used, with a few studies using community-based data sets from care homes, universities, or home care settings. The most common algorithms were things like decision tree, random forest, neural networks, but there were many more algorithms reported because there's lots of different computational techniques in AI. So our first research question was around how involved nurses were in AI research. We found about 1/3 of studies were actively led by nurses who were the corresponding author, and that was really encouraging to see. I wasn't sure really when we started the process how many would be led by nurses, but there was quite a few. Those studies that weren't led by nurses came from different disciplines such as computer science, engineering, medicine, medical informatics, and a few were led by commercial companies like Google who are active in the space. There were a smaller number of studies, about 7%, where nurses actively participated in the research by providing clinical expertise to validate the results of an AI model and whatever predictions it was making. And then there were a smaller number of studies, about 15%, where nurses took a more passive role in the research by providing some or all of the data set for analysis, or they assisted with the implementation or use of an AI-based technology in a healthcare setting, but they didn't sort of actively contribute expertise to the development or validation of the AI techniques, models, or systems being used. So that's kind of how we differentiated about between being actively or passively involved. And then finally, in quite a few studies, nearly half nurses did not take part in the development, implementation, or use of AI, but they could be potential future users, which is why we included those studies in the review. I won't go through specific examples of any of those studies, but there's a lot of more detail in the published review. And just to note that the journal we published in only allowed a maximum of 50 references, so we couldn't cite all 140 studies, unfortunately, but we referenced as many as we could, and you'll find a summary of all the study characteristics and the DOI link for each one in the supporting files, and they're available to download from the journal website if you want to track any of them down. Then our second research question was about how AI has been applied across the nursing profession. So the vast majority of studies, not surprisingly, were related to some form of patient care, with the most common clinical areas being critical care, general nursing care, which was sort of a mix of medical and surgical stuff, wound care, infection control, older adult care, hospital readmissions, midwifery, emergency care, and hospital discharge. About 15% of the studies were related to nursing administration and management. So that was things like how AI could improve data quality or written nursing notes. And then a few studies looked at how AI could predict nurse staffing in acute settings, burnout among nurses, their job performance, or levels of bullying. There were only 4 studies related to nursing education, and they used AI algorithms to predict student attrition from nursing courses, academic failure rates, graduation and completion rates. And there was one study about how nurses could learn to use an echocardiogram using AI-assisted software. And unfortunately, we didn't find any studies of AI being applied in the research process itself or anywhere in the policy arena. And again, there's some more examples of those in the published review. Then our third research question focused on the benefits, limitations, and risks of artificial intelligence. So firstly, looking at the benefits. Most of the studies reported potential benefits because they only developed and tested AI algorithms or gauged people's perceptions of them. They weren't actually used in the real world with practicing nurses to inform decision making and care delivery, but the algorithms were tested on real health data sets, which I think is useful. A very small number of studies, about 12%, actually implemented an AI-based technology in a healthcare setting that was used by nurses and reported some benefits, but the quality of those studies tended to vary. Some had quite weak study designs, so the reported benefits are probably a bit questionable. But overall, the benefits reported, whether they were sort of potential or actual, included increased accuracy in predicting various health, education, and other outcomes, or identifying variables that would affect outcome prediction in the models that were developed. And then a few studies reported potential improvements in nursing documentation and data standards, the management of nursing staff, triaging patients, making clinical diagnoses, or monitoring patients and their environments. And again, there's more specific examples of the benefits of AI in nursing in the published review. Then when we looked at the limitations of artificial intelligence, they mainly related to the quality of the data sets that the techniques were used on, because the data sets could be missing information, such as details about the socio-demographic profile of the population. Some of the data sets had self-reported measures which aren't always reliable, or had clinical measures that could be different in other regions and health systems, which might reduce the accuracy of the predictive models if they were applied elsewhere. Another limitation was that alternative AI techniques, might give you different results, because most studies only used 5 or 6 different algorithms, and there are many available and more being developed all the time. The retrospective nature of the data sets was another limitation, because they may not accurately predict future events, and COVID is probably a good example of that. And then a few studies mentioned that healthcare professionals still needed to interpret the results of any AI predictive model to ensure the results were clinically relevant, and that nurses should have assisted more with testing, implementing, and evaluating the AI-based technology. And again, examples of the studies reporting the limitations of AI are in the published review. And then finally, there weren't that many risks associated with AI reported in the studies, which was a bit surprising. But the ones that were sort of a mix of ethical, legal, and social risks, such as the perception that AI could replace nurses and other professionals, or be used to supersede clinical decision-making. There was also a concern that nurses lacked knowledge and skills in AI, and that this was a risk to its future development and use in healthcare. And a few other studies noted the lack of transparency in how some algorithms work, which is often referred to as black box AI, which could cause safety and trust issues. And then a few studies highlighted the costs involved in gathering and analysing digital data sets versus the benefits we might get from using them, because AI is very expensive. It's not a cheap solution, and we don't know if it's cost effective or not yet. But overall, there was very little reporting of the risks of artificial intelligence. And again, there's more examples of those specific studies in the review. Just to flag up as well that our systematic review didn't cover all the limitations on risks of artificial intelligence, because obviously we were just limited to what the studies reported. But there are some good reports from the World Health Organization and the United Nations that go into a lot more detail about the sort of ethical and governance issues to do with AI. So algorithmic bias is probably the biggest problem with AI at the moment, and it's not really an issue with artificial intelligence itself, but with the quality of the data sets that are used to train AI models, and the lack of thought that sometimes goes into analysing digital data, because AI is only as good as the data set it's based on. So if certain aspects of people's socio-demographic information is missing, or maybe certain populations of patients are overrepresented or underrepresented in the data sets that are used, then the predictive model is just going to reflect that. And there's already several examples of gender bias, age bias, and racial bias in healthcare and other areas of society that are being exacerbated by the use of artificial intelligence. I've written a small bit about algorithmic bias. It's just a short discussion article in Nursing Outlook, in case that's helpful. So some of the key findings for the nursing profession, from our review are firstly that nurse leaders should strengthen capacity in the workforce to collect good quality digital patient and administrative data, and ensure key nursing data sets are available to develop AI tools. So this might mean advocating for more technical infrastructure, such as things like electronic health records and mobile ways of working to collect data at the point of care, although there is a significant cost involved in doing that because it's not cheap or easy to do. Secondly, nurse practitioners ought to seek opportunities to develop, implement, and evaluate AI-based technologies to determine their clinical utility, and collaborate with colleagues in computer science and other disciplines to do that. Nurses could also become more involved in AI governance to ensure these computational techniques are applied appropriately and vulnerable patient populations are not disadvantaged by the use of predictive algorithms. Our fourth recommendation then is for nurse educators to create curricula on artificial intelligence and integrate this into existing teaching programs so that students and practicing nurses get the knowledge and skills that they need to lead and participate in AI initiatives in healthcare. And finally, for nursing scientists or researchers, we should conduct interdisciplinary research examining if AI-based technologies are effective in improving patient and other outcomes to strengthen the evidence base in this emerging area. And we should also explore in depth the limitations and risks of AI to help minimize any negative impact it may have, including the impact on nurses' workload and workflow, and how to go about implementing AI-based technologies in various clinical settings. So just to flag as well that our review had some limitations like any literature review. The main ones that we didn't search the computer science or engineering databases, which would definitely throw up a lot more studies. And we didn't do any critical appraisal, as I mentioned, because we were short on time and the studies were quite sort of technical in nature. So the kind of strength of the evidence base isn't clear, but hopefully the review is a useful summary of AI in nursing. So although we're in the early days of artificial intelligence in nursing, it's a bit further along in medicine. AI is definitely here to stay. So as nurses, we need to get more involved. I think the take-home message from our review is that we need good quality digital patient and administrative data sets and a lot more informatics expertise in the nursing workforce in education, research and clinical practice so that we can work with colleagues in computer science and other fields to test AI algorithms and if they're effective, implement AI-based technologies to improve patient care and professional practice. So I've been trying to work on some of those recommendations from the review over the last year or so. On the education side, I've developed curricula on artificial intelligence, and that'll be going into our undergraduate and postgraduate programs here at King's. And I've published a bit about AI in nursing education as well, including a rather controversial editorial using ChatGPT as a co-author in case they're helpful, and they're linked on the slide. Just recently, I've also published a two-part series of articles in the Nursing Times about generative AI in nursing education. So we did a SWOT analysis of the strengths, weaknesses, opportunities, and threats of these sort of new digital tools, because we think nurses can use generative AI to help create new learning opportunities for students, but also we need to be aware of the limitations and risks of these new digital tools pose. So I hope those articles are helpful for nurse educators and for students. If you'd like to do more reading on AI, these are some really nice books I'd recommend. The first one on the left is from Hannah Fry, and it's just a general chit chat about AI in all areas of society, not just healthcare. And it's quite nicely written. There's some very sort of funny stories and little case studies in the different chapters in the book about how AI can help us, but also how if it's not used appropriately, it can go horribly wrong. And her book is really nice and short and easy to read. It's for a lay audience. Another book I'd recommend is from The New Scientist. It's called Machines That Think. Again, it's for a lay audience and a general reader. It's not too technical, but it does go into more depth about where artificial intelligence has come from, how it's developed over the years, and how it's being applied in different ways, and some of the problems with it, because AI is not perfect. Like any technological trend, it has its benefits, but also its limitations and risks. And then if you really want to delve into artificial intelligence in a lot of detail, there's a great textbook. I got this recommendation from a colleague in computer science, and I have the book myself. And the book is Russell and Norvig's latest edition from 2022. It's the fourth edition, so it's been around a good while, and it covers all the major areas and domains within AI and looks at some of the ethical and philosophical issues around artificial intelligence as well. It is quite technical in places, but it is a classic textbook in the field and well worth the investment if you're really interested in this topic for education or research or practice. Also, if you're looking for some free training on AI and data science, then we have an online Innovation Scholars program that runs here at King's. It's freely available to sign up for, and you can pick and choose a whole range of introductory courses from things like how to code in Python to learning more about NLP or deep learning, etc. And the link is on the slide for that. It's all sort of self-directed. It's just a series of videos that you can work through and some practical toolkits for some of the more technical topics. So all you have to do is set up an account, log in, and off you go. You don't need to be a staff or student at King's or any of its affiliated hospitals to access this educational resource. It's available for free. Then on the research side, I'm working with a great nursing colleague, Dr. Emma Stanmore, who's based at the University of Manchester here in the UK. And Emma has developed an online exercise platform called Koku, and there's a mobile app version of it as well. I can never remember what the acronym actually stands for, but basically the app is for older adults to encourage physical activity to reduce their risk of falling. So the app has been approved by NHSX here in the UK, which is sort of the digital arm of our National Health Service. And it's been given a very good rating by Orca, which is an independent mobile app rating agency. And Koku is available to download for free from any of the app stores. It's also available in multiple languages, not just in English, and it's currently being used in several care homes in Manchester City. And along with lots of exercise videos and games on the app, there's also some simple questionnaires about a person's mobility, quality of life, etc., which we're using to develop a predictive model for falls in community dwelling older adults. And then if the model is good quality, we'll do some co-design with older people who use the app to create a digital dashboard so that we can give them information on their falls risk and evidence-based strategies to prevent a fall at home or in a care home. And we've just had a PhD funded through the Medical Research Council here in the UK to work on that piece of research for the next few years, which is great. Then on the policy side, I've been involved in the Phillips Ives review, which was led by Natasha Phillips, the former CNIO for NHS England, which is the National Health Service here in England. And that review was all about digital transformation in nursing and midwifery in our country. I was an expert on the AI and data science panel last year. So hopefully when this report is published, I think it's due out the end of this year, that will be influential in getting more investment in nursing informatics across the board, including AI stuff. So I know artificial intelligence might seem like the furthest thing from nursing, but it's not really. Historically, nurses have focused on hands-on care, and that will always be the core of what we do. But just like Florence, we need to use the data that we collect on our patients to improve the care we deliver. And in the 21st century, the best way to do that is to collect data in a digital form and analyze it using AI and other computational techniques to understand and improve our practice and patient care. So that's everything from me. Feel free to drop me an email if you have any questions, if I can't get to them all today. And you'll also find me on Twitter under AI Nurses. Before I finish, I just want to say a quick thank you to Sigma Nursing for hosting the session, and to Linda and Megan and everyone else in the background for doing all the legwork. So thank you for listening. I hope you found some of that useful, and I'll hand back over to them now for some Q&A.
Oh, look at all of this wonderful feedback that we're getting with all of the emojis. I love it. We have many questions. So just
Sure.
as Siobhán had said, if we do not get to all of the questions today, please feel free to reach out to her either on social media or through her email, because I anticipate we might not get to everything today. So let's just kick it off with the first question. How relevance and good data privacy versus ethical aspects in securing data in nursing research? So what do you think about getting good data versus privacy, and what does that look like in regards to ethics in nursing research?
Sure. Well, I guess good data is really essential for any piece of research, whether it's AI related or not. And if you're going through the ethical approval process, then you'll be going through all of the data management plans that you need to produce and thinking about all the different aspects of managing the data securely and ethically. So I think there's a good and reasonably robust process there if you're doing research in terms of collecting data, whether you're doing primary data collection yourself or whether you're accessing a secondary data set and using that for analysis. So I think if you follow the process that are there in your institution, whether you're in a university or maybe in a health service, then there shouldn't be any major issues, because you do go through the ethical review process, and a lot of people with expertise on the review panels will give you feedback about how to collect and analyze your data appropriately, and will give you hopefully ethical approval if you can answer all their questions and put all the right processes and systems in place to make sure your data is collected correctly. So I think on the research side, we're quite lucky that we have those systems and processes in place. They're not always 100% perfect, but I think most universities have been doing research for so long now that they're sort of reasonably robust. And if you get good training at your university about how to collect your data and manage it appropriately, then I think we can tackle that one. It's a good question, though.
To coattail off of that in regards to privacy, what are the disadvantages of AI in regards to patients' privacy?
Sure. I think there's lots of thorny issues to do with patient data because I guess our patients are use lots of different devices and systems that aren't necessarily connected with their healthcare service. So they might use an app on their phone, they might use a wearable that comes from a commercial company, they might be going on social media and discussing, their illness that they have and what sort of treatments and management techniques they use. And all of that data is managed, by different private companies that provide those products and services and how they manage that data, I guess, it has some legislation and regulation depending on the country that they're based in. But as we've seen in the media over the last few years, that's not always managed very well. And I think if patients are using devices and tools by private companies, they need to think carefully about what happens to their data and what kind of data they're happy to share with those companies. If the data is managed by a public health service, that's slightly different in terms of the privacy issues. Mostly the data is collected in relatively secure ways, whether it's on paper or it's electronic. Every now and again, I know in the UK we've had a couple of years ago, our health service was hacked, and systems do get hacked externally, and sometimes data is stolen, or people might lose a device, a laptop, if a member of staff is out and about doing things. But more often than not, I think on the health service side, the data is reasonably secure and robust, and there's less privacy issues there. But I think where there's private providers providing a whole range of different devices and apps and services online, that has lots of risks for patients. And I think patients are aware of some of those risks because there's been lots of stories in the media, certainly here in the UK, and I'm sure in other countries, of patients' data going astray and having a negative impact on them. But I think, over the last couple of years, we've had some improvements here in sort of the UK and wider Europe. We've had a piece of legislation called GDPR, which has strengthened sort of the protection of people's data and how it's used. Hopefully in other countries, they're following similar lines. And I think it'll improve over time as people become more aware of how valuable their data is, and that they should really think more carefully maybe about how they share it, especially in a digital form, because once it goes digital, it's more difficult to hang on to it and keep it private. So there is lots of thorny issues, and I hope some nurses are already researching data privacy issues, especially around AI, and I hope more nurses get involved because it is a big area of research and practice and something we need to be careful of about how we manage our patient data, and then more broadly, I suppose, who we share it with outside of the hospital or health service facility.
So
great question.
Going off of that question, these questions are excellent. I love the questions that are coming in. So what about, is there a difference with the term AI and then our regular computer results or outcomes on the electronic health record? So is the EHR AI?
Good question. I guess AI is a little bit different from standard software techniques. So I guess every EHR system is slightly different, so I can't speak to every one, but generally most electronic health records would be based on kind of standard software techniques in terms of analyzing the data, so they wouldn't necessarily have AI in there. I'm sure some of the EHR providers in the US are really on the ball, and they're starting to integrate some AI analytics into the back end of their EHR systems. To what extent that's happening, I'm not really sure, to be honest. We're just sort of introducing electronic health records here in the UK to varying degrees of success. Some of the big hospital NHS trusts are just, when I was in Manchester, for example, last year, they were just rolling out a big Epic platform across 5, I think, of the big hospitals in Manchester City. I'm not sure if had any AI integrated into the back end analytics, but it wouldn't surprise me if they had now, because a lot of the techniques are quite standardized. And I suppose nurses and frontline clinicians wouldn't necessarily be aware that AI has been integrated into some of the back end analytics of EHRs unless they were told explicitly, or unless it pops up on a screen to say, if you're using some sort of clinical decision support tool around whatever, sepsis or falls or whatever, and it just tells you that, there's been some AI techniques analyzing the data. You might not be aware of it, but I think most standard EHRs would just be based on standard software techniques and just traditional statistics, which aren't necessarily AI. But I think as time goes on, we'll definitely see more AI algorithms, predictive models being integrated into the back end. how clear that will be to front-end clinicians, doctors and nurses, I'm not sure, but I think it will be interesting to see how that sort of unfolds, because I suppose there's benefits and there's pros and cons with either approach. It's really about making sure that the predictive models are accurate and robust, and making sure they're clinically validated before they are integrated into EHR systems and just become part, standard practice of what we do and how we process and analyze our data, and then the decisions we make from that. So I think that's probably ongoing in a lot of EHR companies, and it's starting to happen a little bit here in the UK, but they're probably a little bit further along in the States on that one. It's a good question.
Thank you for that. And so, shifting gears just a little bit, in light of your systematic review, which revealed a limited number of studies in Africa, do you foresee AI potentially exacerbating the digital divide between high-income and low-income nations? Specifically in the context of nursing, what strategies can be employed to mitigate this gap and to ensure equitable access to AI advancements in healthcare across the different regions? Oh, that's such a good question.
That's a really good one. A really tricky one to answer. I think, yes, the first part of the question, yes, it will definitely exacerbate inequalities, and not necessarily just in Africa, all across the world. People who sort of understand AI, how can use AI tools, probably will have better outcomes and than those who can't. So I don't think it's exclusively confined to the African continent, but certainly there in low resource settings where they mightn't have as many electronic systems in place for capturing data. And AI is very expensive to develop and integrate into different electronic platforms. So that will be slower, I think, in low and middle income countries. One area where I think there will be some positive light will be around mobile technology. So many low and middle income countries do use smartphones, even if they're very simple versions. And that's one good way of collecting data, and you can easily integrate AI analytics into an app. And I think that would be one of the cheaper solutions to get AI tools out into different low middle income countries and parts of Africa. On the nursing side, what we could do is, I suppose, just reach out to colleagues in different low middle income countries. I know lots of nursing colleagues here and in every institution working in different global health areas in parts of South America, parts of Asia, parts of Africa, and to continue to do that and to expand that as much as we can and reach across the divide to try and share educational resources to upskill nurses in Africa and other parts of the world, and to develop the technical infrastructure that they already have, and make sure it's sustainable, because some of the tech is very heavy duty. The hardware and the software is expensive. It needs to be replaced maybe or updated every couple of years, and to try and find low cost, robust technical solutions that are really going to work in low middle income countries, because I think it will sort of pan out slightly differently there, because they don't have the same resources as we do to really heavily invest in super duper fancy pieces of software and hardware. But I think mobile devices so far have worked quite well in different low middle income countries and parts of Africa, and I think that's probably the best way to roll out AI tools with people there. That's a very good question though. Thank you.
With AI streamlining nursing and various medical tasks, do you think that AI may replace nurses or other healthcare team professionals? And what do you think it looks like in the future for various AI implementation in the healthcare setting?
Yeah, I get that question a lot about will AI replace nurses and other professionals? And I really don't think it will. I know you get different perspectives from different people, but because nursing is such a hands-on profession, and so is medicine and lots of other clinical colleagues in the health service, it's a really, really hands-on role. Yes, some of what we do is around, documenting care and reporting that into hospital management or whatever management are running the health service. But, large parts of nursing are still very hands-on, and I don't see any AI tool replacing us anytime soon. We're not talking about the mass rollout of robotics powered by AI that are going to replace nurses wholesale, mainly because robotics and AI are horrifically expensive, and nurses are dirt cheap labor by by comparison. And AI is, really good at crunching data, any kind of data, really, really quickly in more sophisticated ways than we've had previously, which is fantastic. And that can really improve our understanding of the data sets that we have and improve our decision making. But as for replacing nurses wholesale, I really, really doubt it. I think it will improve our decision making, speed up aspects of what we do, hopefully free up our time to deliver better care. For example, I know some nursing colleagues here in the UK are trialing speech recognition tools to free up nurses from a lot of the documentation that they do at the bedside. So instead of having to write out everything or type it into a computer, you can just use an audio device that's connected to your EHR to record a lot of your patient data, and then that automatically goes into your electronic health record. It should hopefully be better quality, speed up the process of collecting data, and then free up nurses' time. To deliver hands-on care, and that voice recognition software is powered by AI largely. So that's a really smart, clever way of integrating AI into nursing practice. But I don't ever foresee nurses being replaced wholesale by AI. Nurses in some other areas that aren't wholly clinical and hands-on. For example, I work at a university, so aspects of my job that are more sort of knowledge-based around sort of knowledge sharing and they're much more at risk of being replaced by AI than any kind of hands-on role. So I still don't think I'm going to be replaced by AI, even those of us that work at a university, because I think our students, they like some online learning and virtual learning, but they also love to meet people face to face, meet other students, meet us who are experienced nurses who are qualified in all different areas of nursing. So I don't think that's going to change anytime soon. If we're really want to educate nurses really well, they still want the face-to-face experience with qualified professionals and not have it all automated via some chatbot. So no, I don't think we're going to be replaced.
That's a wonderful answer. Thank you for that. And I'm going to sneak in just one more question. I'm actually going to combine a few questions that came in through the chat. So speaking of education, what do you think are integral parts that need to be part of nursing curriculum in regards to AI principles and practices, and how can we start incorporating that into the nursing curriculum?
Sure, and that's a good question. Hopefully, some of the resources I shared are helpful. So I use the WHO report on ethical and governance issues to do with AI because they have a really nice framework that's quite good. I use my own systematic review because there's loads of case studies from the research studies that are published that I can use with our students. And I've pinched bits and pieces from the textbook that I recommended. It is quite technical, so I don't use a lot of it, and just try and simplify it down and give students practical examples of some practical tools that they can use that are powered by AI. So I think for our sort of baccalaureate or undergraduate students, just the principles of AI and some of the basics of how some of the algorithms work, that's enough. And some practical applications of the tools in different areas of nursing, just to kind of whet their appetite and give them enough to get going. And then maybe for, more qualified nurses who maybe who are specializing in particular areas, or nurse managers or nurse directors and leaders, they can take on a bit more detailed information, and they might want to learn maybe how to code in Python on R. They might want to learn a bit more about some of the predictive modeling and how that works. And there are courses available at every university in machine learning and NLP now, which is great. And there's plenty of resources available online as well, good textbooks and good online resources. So I think every nurse, it doesn't matter what area you work in or what job you do, I think having some foundational knowledge on AI is important because it is going to creep into all different areas of our practice over time. And the more nurses get involved, the better systems and tools that we'll end up with. Otherwise, we're just going to have lots of digital tools imposed on us that might not really suit the way that we work and the care that we deliver. So I think it is really important that nurses sort of learn a little bit about this and get more involved over time and develop your own AI tools that you can apply in your own practice areas, whether you're out in education or research. And I think over time it would be great to see more nurses involved in AI education and research.
Wonderful. Thank you so much for answering all of these questions. Of course, we did not get to all of them. So as
Sure.
you can see on the screen, here is the contact information that she is willing to share with all of you. So please feel free to continue the conversation and the dialogue in regards to AI and nursing. We are so thankful that you took the time today to share with our audience, and we definitely look forward to hearing more from you in the future. I am going to share a link in the chat that is to your nursing centered article that was
Oh,
just
thank you.
put out last week in regards to AI-driven healthcare. So please feel free to visit that link as well. We hope that you all enjoyed this webinar. As a reminder, 1 week from today, you will receive instructions on how to obtain your nursing continuing professional development certificate. We hope that you check out Sigma's upcoming webinars and other resources to support you and your colleagues at sigmanursing.org. Thank you so much, everyone, for joining us, and we hope you have a wonderful day.